Well, hello, everybody. Welcome to another Zoom call. We go over your questions, hopefully get some answers. Reminder to everybody to look at the member site to see any announcements, and now that you can self-schedule calls and any follow-up calls or anything to go over any labs or anything like that. Make sure you do that. Makes life a little easier. Okay, first question. After a recent cheek swab testing, you suggested 2 tablespoons per day of the Highland 951. Since I can't afford $55 a week for one supplement because that supplement is about $55, and 2 tablespoons will probably be consumed in about a week, should I just skip it or do whatever I can afford? This is a good question for everybody. Like, what if I can't afford to continue at the dosage that you asked me to continue at? What should I do? Well, there's really 2 ways to do it. You could drop down to a smaller dose per day, or you could take the recommended dose just a couple days a week. So if you could afford $5 a month for that supplement, by taking it maybe 2 days a week, maybe take it on Sunday. That's one way to do it. So you're getting a higher dose that's affecting the tissue over those 2 days. That's one way to take it. So it depends on the supplement. Now, Highland 951 is a supplement to help dislodge bad estrogens from the estrogen receptor on the cancer cell itself, the cancer membrane, cell membrane. So in this case, I would suggest you take a lower dosage per day. So with this supplement, it'd be better to have a lower dosage per day so you have some residual dosage in your tissues on a daily basis. But other supplements, it may be better to. I did create a video on pulsing supplements, but in this case, I'd say lower dose per day would be better. After a cheek swab, you recommended Turkey Tail Complete. Do you prefer this over the Host Defense Turkey Tail? I included my Host Defense supplement for you to test. Does the fact that you recommended this other one mean that the Host Defense did not test as well for me? That's correct. So when we test supplements, I test them different ones, and the Turkey Tail Complete just tested better for you. Now, in this case, in a case like this, let's say this person, I don't know that this is true, but let's say they have a whole bunch of Host Defense Turkey Tail in their cupboard. I would certainly not want you to waste that. So unless the person, the caveat would be unless the person is in dire straits health-wise, and they're doing very poorly, and the Turkey Tail and one brand supplement tests much better than the other brand, then by all means just make the switch. But if you're doing fairly well and you're not in that case scenario, and you have excess of the other brand still at home, I would use that up before you change. But finish that up and then change to the Turkey Tail Complete after you have finished up the other brands that you have in excess of home. So yes, whenever I make a recommendation for a brand, it's because that particular brand tested better. When I'm supposed to be dairy-free, can I still eat raw dairy? And the answer is no, you can't. So this is a question from somebody who has cancer, right? And if dairy is driving your cancer, then it doesn't make a difference if it's pasteurized, if it's homogenized, if it's not pasteurized and homogenized. It doesn't also make a difference whether it's cow dairy or goat dairy or sheep dairy. So all of those have the capability of driving cancer and stimulating growth of cancer. So when we tested you to be dairy-free, we test all those dairies. So now this is different. This would be a different question if the person was asking because they don't have cancer and it's not because the dairy is driving the cancer. But is if they have a dairy allergy. So if the person did, let's say, food sensitivity test, let's say they did a Cyrex array for testing for cross reactions to gluten, or array 10. These are testing for casein. And the reason why I like the Cyrex, because it does differentiate between different types of dairy. And it differentiates the form of dairy, meaning it might be cow's milk is positive, but cheese you can't eat. So some people that have a casein sensitivity, that's a totally different ball of wax, and they may not react to a certain type of cheese, but they react to another type of cheese, or they react to milk itself. For instance, I know people who can eat goat's cheese. We're not talking about cancer patients. We're talking about people with a sensitivity. They can eat goat's cheese, but they can't eat cow's cheese. It's because the casein is slightly changed and differentiated. The protein itself is different between sources, and the protein can be different and changed and altered when in the cooking process. But that has to do with sensitivities. That has to do with the presence of antibodies to a protein or a peptide, portion of a protein. So when we talk about cancer and what's driving cancer, and I recommend be dairy-free, it doesn't make any difference in raw dairy. It doesn't make any difference what type of dairy, I mean sheep's dairy, goat's dairy, cow's dairy. And a slight caveat to those who sometimes ask this question, are eggs dairy? No, we talk about dairy is coming out of an udder of an animal. So hopefully that clears that up. Why is gluten bad for your brain? So from a cancer standpoint, gluten is almost never a driver of cancer. However, gluten can be a driver of inflammation. So back to the antibody answer of the question before, if I have antibodies to the protein in gluten, which is gliadin, or a peptide, meaning a portion of the gliadin protein, every time I eat protein, I am going to cause inflammation, first in the gut, and then elsewhere in the body. So gluten has, in your intestinal tract, you have gluteal morphine receptors that fire back to the brain. You also have caseomorphine receptors that fire back to the brain that have to do with dairy. Casein is the protein in dairy. Gliadin is the protein in gluten. So if you have antibodies to gluten or casein, you will fire back into the brain and you'll cause an inflammatory process in the brain. That's why gluten and dairy can be bad for your brain, because it can cause that inflammation in the brain. Heard any of my videos, I've always said inflammation in the gut equals inflammation in the brain, because of these connections. So when you have inflammation in the brain, then that causes brain fog, that causes all sorts of problems. Now, a person who has had head trauma, let's say they've had post-concussive syndrome, let's say they've had Lyme disease that crossed the blood-brain barrier. Let's say they had vaccine injury that has crossed the blood-brain barrier. Let's say they had brain cancer or a tumor. So they already have some other source of damage to the brain / inflammation of the brain / microglial cell priming / antibodies to neural tissue for the brain, the upper motor neuron system. Any of those things are present or have been present in the past. Eating anything that could be causing inflammation in the gut, not even gluten or dairy per se, anything else that you may have antibodies against, you're causing inflammation in the gut. You can cause inflammation in the brain as well. That's why anybody that has those things really should do a Cyrex 10, really a 3x Cyrex array 3x, Cyrex array 4, and Cyrex array 10 would be good. So if you're having serious, and this goes for even people that have had a lot of chemo and they have chemo brain, it's because that has damaged the blood-brain barrier. Chemo, being an oxidizing agent, can damage the blood-brain barrier, which is just a single cell protection around the blood vessels in the brain or by the astrocytes. Those can become damaged by all sorts of toxins and chemicals, including chemotherapy, and then things cross that lack of barrier and get into the brain and cause inflammation in the brain, damage cells. The most commonly damaged cells in the brain are these microglial cells, and they can become damaged, what is called primed, and those can be just a source of constant inflammation. And again, worst case scenario is that you end up developing antibodies against neural tissue, brain tissue. And then you have a problem because you're basically set up for, you have basically an autoimmune disease in the brain, and you're set up for destruction of neural tissue whenever you have antibodies against. So every time you eat anything that's going to cause inflammation, or you're exposed to things that cause inflammation, or you have inflammation even from exposure to a virus, or you get a cold, you're going to damage that which you have antibodies against first. And if it's to neural tissue, you're going to have issues. So gluten can be a bad player, but a lot of foods can be a bad player. But so you want to test for those. That's why you would test for foods. Oh, what am I dealing with that for? I have breast cancer, because you don't want other forms of inflammation that take, energy, you could say, away from your immune system that you're trying to kill this cancer. So can be wise to test for those. That's why I give you guys access to the autoimmune course. Well, I don't have autoimmune disease. I have cancer. I'm trying to deal with that. Yeah. So still, you have comorbidities that decrease your body's ability to be able to kill cancer. So the more you can learn about how to find those triggers and deal with those, and remember in my book, I talk about most people with cancer also have a comorbidity of an autoimmune disease. So understanding that can be very helpful in your cause to combat, cancer as well. So don't neglect that. What are the dangers of using a statin drug to lower cholesterol, especially with the cancer diagnosis? Well, statin drugs do lower cholesterol. You can't argue with that. However, they also do all sorts of damage to the liver itself. And there are long-term studies, and I didn't pull any of those up, but there are long-term studies showing that, people taking a statin to lower cholesterol really don't have any better outcomes as far as reducing coronary artery disease or having any type of lesser incidence of myocardial infarction. So just because you can alter a blood value with a drug doesn't mean that you leave a patient any healthier. So I'll say that again. Just because you could use a drug to change the value of a blood marker to put it back into more normal range doesn't mean that you've actually made a healthier patient. So be careful about that. It's just like men with prostate cancer. They have an elevated PSA. You go on androgen deprivation therapy, I'll guarantee you that at least for a couple of years, your PSA is going to be in the normal range. But don't be fooled to think that that has solved your problem and your cancer is gone. You've just lowered the PSA marker artificially by taking a medication. You haven't necessarily reduced that person's chance of metastasis or, increased their life expectancy. I mean, if you're really just solely concerned about getting a blood marker back in normal levels, just cross it out on your blood test and just write a normal level in there. If that, makes you feel better. What are you talking about? That's absolutely idiotic, right? Well, that's kind of what we're doing by just using medication to get the marker back into lower level. And it's far less destructive because you crossing it out on your blood test doesn't have any side effects. I'd rather not have you do either one of those things. The smarter thing to do is to try to figure out why. Now, sometimes cholesterol as a marker is difficult because some people can have a elevated cholesterol that is hereditary. You can have hereditary factors that you have hypercholesterolemia and that you can't really do anything to lower it. Some people have a perfect diet, they're doing everything perfect, and they still have elevated cholesterol. Maybe that's just normal for them. Understand values. It's like the normal temperature is 98.6. Well, some people's normal temperature is 96.6, and some people's normal temperature is 99.6. That normal temperature is just, the average of human race that has been tested. So sometimes you can do everything right and you can't get your certain levels back into normal. Is that increasing your risk for different things? Maybe, but I don't see that using a medication that could have other side effects is the smart thing to do. Now, is there a greater risk with a statin drug with a cancer patient? No, I don't think there's any greater risk with a statin drug with a cancer patient unless they also have liver cancer, but I haven't seen any data on that. Why is iodine not a good idea for someone with breast cancer? I do not have a thyroid cancer, and I take compounded thyroid medication. I'm told there's a link between thyroid cancer and breast cancer. Well, iodine can be a good thing for breast cancer used acutely. So I don't think that breast cancer patients should be on iodine long term. The problem with iodine in the thyroid is the thyroid needs iodine in order to make T3. So that's a necessary component. But when we take exogenous iodine in a supplement, it's basically taking a hyper dose of iodine. You're really stimulating a lot of attraction to the thyroid gland by the immune system. And the chance of you developing an autoimmune thyroid, if you're taking iodine long-term, the chance of you developing Hashimoto or Graves' disease is almost 100%. That's why I'm not a fan of taking iodine long-term. So if somebody just finds out they have breast cancer and they're going to take iodine for 3 months, that's fine, especially if the test's fine for them. But if they're going to take iodine for a couple of years, the chance of them end up developing Hashimoto's, even prior to any hypothyroidism, primary hypothyroidism, is very, very high. So that's why I'm not a fan of iodine. Now, I am a fan of iodine in acute situations. Let's say you have acute, breast cancer or even acute radiation exposure can protect the thyroid for a very short period of time. But you have to be careful with iodine. You want to take a food-based iodine, a kelp-based iodine if you're going to take it, and not long-term. That's just my opinion. This was a question from somebody who called in today. With the version 6.04 software on the Rife computer, can you just send a flash drive for a program update? Well, the answer is yes and no. So yes, I can, if you know how to put it into your computer correctly. So with the version 6.4 software, you have to create a folder in the documents folder that says True Rife frequencies, and then put your software, your program into that. If you know how to do that and you feel really comfortable doing that, then absolutely I can just send a flash drive. If you don't know how to do that or you don't feel comfortable for doing that, then I'd rather just have you send me the computer. If you want, if you say, I'm going to give it a try, I have no trouble with that. But if you say, I'm going to give it a try and I'll call you if I need help, then I do have a problem with that because we don't have as large a staff as we used to. And it would take me longer to try to walk you through it on your computer. Now, on the member site and on the Rife frequencies course, I put all the instructions on how to do that. So somebody who's pretty computer savvy, it's really super easy. But if you're like, I don't know the computer, or, I'm not very good at the computer, then I'd rather have you just send it to me, let me do it, and I'll send it back to you. So, so for the person who did ask this question, you could email me if you want just a flash drive. I was just diagnosed with pneumonia and have been prescribed 2 antibiotics. Any suggestions to counter what they are going to do in my gut biome? Yes. So as I've said many, many times, if you're taking an antibiotic, you have to take a probiotic with it. Will you counter what you do to your gut biome? Yes, you will do some countering. You're not going to correct all the damage that's done, but you will. There's been studies that if you take a probiotic, and the studies were interesting because it wasn't even specific to what type, of probiotic. Just taking any probiotic that you have is going to help you tremendously. And the studies were pretty dramatic. It really, really helped a person not have gut issues post antibiotic use. So whatever probiotic you have, most people have something in their house. Just start taking the probiotic. When you take the antibiotic, you could take it, between doses as well. The only negative is if you take too much probiotics, you could get a little bit of runny stools or something like that, or you could just, waste your money too. You can't solve your gut problem by just taking a ton of probiotics, but you can prevent the damage that an antibiotic will do, because an antibiotic is going to kill, a large percentage of your gut biome. What other things can you do to help install a better gut biome? Variety of diet is your key. So eating different vegetables, a lot of people get used to, they eat the same thing all the time. And I know I'm speaking to the choir with you guys because you're good at understanding this stuff, but maybe there's even people listening to the call that they do eat the same thing all the time. And their idea of eating vegetables is eating corn with their meatloaf. Well, corn is a grain, it's not a vegetable. So you've got to be eating a lot of different vegetables, eating fresh things, eating some raw things, eating a variety of different foods, changing up your diet. Your gut biome actually changes on a weekly basis. So the more variety of stuff that you can eat, the better off you can be. Today, I have found out we can buy ivermectin over the counter from the drug stores. I heard a lot of good information about this drug and cancer. Can we take it, and what would be the benefit? So I have been hesitant to comment about ivermectin in the past because it's a prescription medication most places. If you just do a Google Scholar search on ivermectin and cancer, you'll find that there's a number of studies that are very positive on ivermectin and cancer. So I don't see any problem with taking ivermectin. The only thing I would suggest is that it is a medication. And we, even though it's a long use medication, it was initially in the market years and years ago, very, very, very few side effects. I would still think that it would be best to pulse it. Any medication can, affect you in negative ways, but it can have very positive effects. So I know there are some people that take ivermectin every day, and it's like, I just want to go, but why? I mean, and I'm talking people who don't even have cancer, so I don't know that I would suggest anything like that. But I don't see, let's say if you're just trying to protect yourself against COVID or some other weird virus that may come out, to pulse it might be a good thing. Have it in your arsenal might be a good thing. I do think that a lot of medication you can become sensitive to, meaning that if you're taking it all the time, you're not going to get as much benefit from it. And saving it, having it in your arsenal to take, let's say if your cancer is doing well and you're doing really well, then I don't know that I would change that and take that. Or if, you don't have a virus and you're feeling well, it might be good to have it in your arsenal if you do need to take it. but I think it is, and obviously it had phenomenal success with COVID. That's why they banned it. I think that Rife question may have been me. Yes, it was. I called it. I don't think my question was very clear. I sent in a cheek swab last week with requesting new Rife frequencies. I wasn't sure how long I should expect to wait for the new frequencies. I already sent an email stating that I could get the new frequency files via flash drive or even download them from an email or Dropbox if they're too large to save on money shipping flash drive. Yeah, we cannot. One thing we can't do, and we've never been able to do, is to email the frequencies because of the way that the folder is, you can't even if you put it in a folder, I could email, then you have to download it, you have to take that and put it in. That's really confusing, and it's even harder to do. So it'd be better if you feel comfortable in me doing a flash drive, I'll just send the flash drive. So I don't know if you heard that answer. You have to feel comfortable about putting it into the computer. And again, the instructions are on the member site and Rife course. I know you've done the flash drive before, but the version 6.4 is different than the version 6.0. So that's what I was saying. With version 6.4, it's very different how the program goes in to the Rife program. It won't go into the main body of the program. So in version 6.4, you have to click, there's 2 more clicks you have to make. So you open program on the version 6.4 right now. If you don't have if you just got a 6.4 on your computer, if you open the program, you'll see all the right programs. But you cannot put a custom program in that folder. You have to go over to the left and click Documents. There's 4 little things you can click on. One of them is Documents, the second one down. And then in Documents, you'll open up that, and there will be nothing in there. So you have to create a folder in that called TrueRife Frequencies, and then you put your custom folder in that. So anybody that has a version 6.4 that I did that on understands that completely and go, yeah, I know, we have 2 more steps. Yeah, now, if anybody started with us recently, they don't know that at one point in time, there was 2 less steps to get into their program. They understand that they have to open up the TrueRife program, hit Open Program, then go to Documents, then go to TrueRife Frequencies, and then go to their program. So 6.4 is different. So if you feel comfortable doing that, I'll just send you the flash drive. If you're confused at what I just said, it is written down in the member site. If you're like, I'm just totally lost, then it'd be better to send me your computer and I'll put it in. Either way, just think about it, look at the instructions, and then either email, let's say, yep, I feel good, send me the flash drive, and I'll do that. Where do we find the clues as to how our cancer is driven? Is it in the initial cheek swab? Yes. And resulting program? No. Well, you're talking about the right program? No, you won't see, or you won't get any clues in that. Or do we get the info from the genetic report? No. So depending on when you started with us, we used to be very open about the causes. We have causes, balancers, and then food drivers. It's just when we got attacked by the AMA, and we had to be careful with our terminology. So we had to kind of take that terminology out, that what was the cause and what was the drivers. We had to be more careful with that terminology. But I'm at a point right now, I just don't care. They can just throw me in jail. I just don't care anymore. So when you look at diet, so when you talk about how our cancer is driven, um, let's clarify that phrase. So cancer is caused from something. So anything that gets inside of a cell that damages the nucleus, the DNA, the replication cycle, and the cell goes into rapid replication. That is the initial cause of the cancer. And it'd behoove us to find that out to help deal with that so it doesn't cause the same thing in another cell. Now, understand, even if you could magically make that all go away, let's say if the cause that got inside the cell that damaged the DNA, that caused it to go into rapid replication, let's pretend it was a mycotoxin. If you could magically remove all the mycotoxins from your body, it still doesn't solve the problem that the cells are still in rapid replication because the damage was done. But if you get rid of that, we know that your body is susceptible to mycotoxins as a cause of cancer. We don't want it to cause another cancer or cancer somewhere else. So it's essential in my mind to find out what that causes and deal with that. And deal with other potential causes, other toxins, other biotoxins. That's why we do that testing. We want to deal with all the comorbidities. That's why I talked about autoimmune diseases and deal with those comorbidities that can be causes of cancer. Secondly, a driver of cancer could be a term that we use to what is fueling the cancer. So remember, cells that are in rapid replication are very hungry. So hungry cells need a fuel source. That's why we take you off of certain things. Dairy is a common fuel source. That's why I recommend everybody with cancer go on a lower sugar diet and keeping your glucose levels, if you test them with a glucometer, at a low range will also be helpful. Doesn't mean everybody needs to go ketogenic. Doesn't mean everybody needs to, do anything specifically. We want to test for what are our fuel sources, and that can change. So in cheek swab testing, if that changes, I make that note and tell you, stay off of this food too. Change your diet. I make those changes. So that's all done. That is all done on the cheek swab. So if we always recheck that driver, so you don't have to request that. Okay, so you don't have to tell me, Patty. I will just send you a flash drive. Take it out. Any questions? Originally, dairy was a driver. When diet said no dairy, this cheek swab, dairy was not a driver. No. So I don't rephrase it. So if 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 I say there's a different driver, then yes. So if I don't tell you again that dairy is a driver, I only make changes on the cheek swab. So when I send you back information on the cheek swab, it's just any changes. So stay as dairy free as possible. But that brings up another question. Can I ever just relax a bit on the driver? And the answer is always yes. So if you've eliminated, a main fuel source for a period of time, is it okay to have butter once in a while? Or is it okay to put some cream in my coffee a few times a week? The answer is yes, always has been yes, because you're never going to completely eliminate the fuel source. So that's kind of a fallacy. You're never going to be able to completely eliminate it. So, and I also have always said this is a diet. It's not a dogma. It's not a religion. You're not, first, you're not sitting by, having some butter on your toast or something like that. So just make sure it, and I will say also that it can be dangerous to even have that thought in your mind because that is producing anxiety. And what does anxiety do but stimulate a sympathetic reaction, which can be the worst thing for your cancer? And I've said over and over, 100 times, a lot of times the people that do the best about their cancer and end up having the best success are the people that are just like, oh, tell me what to do, I'll do the best I can, and I'm gonna leave the results to God. The ones that are frantic and anxious and worried and concerned and analyzing everything and getting, you know, having OCD issues about their cancer. Um, again, the problem with that is it stimulates glutamate, it stimulates sympathetic dominance, it shuts down your immune system, and uh, and it shuts down your detoxification pathways. All those things are not good. So don't ever beat yourself up about, oh my goodness, it was my son's birthday or something, and I had a bite of cake. I feel so guilty. Okay, it's not a sin. That's not how we're supposed to even act with spiritual things. The Holy Spirit doesn't beat you up. When you make a mistake, he he molds you, shapes you. Sometimes that's not pleasant, but he's gentle and graceful and merciful, and that's the way you need to be with yourself when it comes to your values as well. All right, with that, we will say good night. I hope you all have a wonderful night and go do something fun while it's still light out. Um, and getting more light out every single day. All right, God bless you all. I'll be praying for you. Love you all. Bye bye.